This is the shotgun technique to help with an innominate rotation. So first, you're going to start by assessing your pelvis. You're going to take your hands, put it on the top of your hips, find your iliac crest. And then from here, we're going to go anterior with our fingers till we get to the bony prominence of the front of our hip, your ASIS. From here, I'm going to bring my fingers, I'm going to bring them down, just hooking underneath those bony prominences. You want to make sure your fingers are straight, and you want to look at the mirror as you assess your hips. When you look at your fingers, you want to see which hip is lower or higher. So for me, my right hip is sitting lower than my left. So for this technique, if my right hip is going into an anterior pelvic tilt, I'm going to want to activate my hamstrings to help bring this innominate into a neutral position. So working for the right hip, I'm going to grab a dowel. When I get onto the floor, I'm going to loop it through so that my right leg is over the dowel and then my left thigh is underneath it. From here, I'm going to bring my hips up to about 90 degrees of hip flexion. Once in this position, I'm going to hold the dowel strong, and then I'm going to extend my right leg, kicking my foot towards the wall, and I'm going to drive my left knee up into hip flexion. I'm going to hold for 5, 4, 3, 2, 1, and relax, and repeat. It's a push-pull of my legs. 5, 4, 3, 2, 1, and relax. And again, 5, 4, 3, 2, 1, and relax. Repeat that portion as many times as prescribed. And then once you're done with that, we're going to grab a band, preferably a band that doesn't have much give, so you can create an isometric contraction of hip abduction or external rotation into the band. So from here, I got the band above my knees. I'm going to go into my hook line position, and I'm going to drive my legs out into the band for 5, 4, 3, 2, 1, relax. And again, driving my legs out, 5, 4, 3, 2, 1. One more time. Driving out, 5, 4, 3, 2, 1, and relax. And then last, I'm going to grab a yoga block. I'm going to put it between my knees, creating an isometric contraction into hip adduction. And then we're going to do the same thing. We're going to squeeze as hard as you can. 5, 4, 3, 2, 1. Relax. 5, 4, 3, 2, 1. Relax. And again, 5, 4, 3, 2, 1, and relax. And then you can reassess your pelvis to see if your innominate has changed.